Now we'll talk about how to use your ICD9 CM book by working through a coding example problem. ICD9 codes contain from 3 to 5 digits. The codes with 3 digits are called category codes. These codes may be further subdivided by the use of 4th and 5th digits to provide greater detail about a disease. This is called specificity. The correct way to determine an ICD9 code is to follow these steps. Step 1. Look up the disease in the alphabetical index, Volume 2 of your ICD book. If you are unfamiliar with the term, look it up in your medical dictionary. While a medical dictionary cannot be used during the CPC exam, it should be at the fingertips of a medical coder in most other situations. As a coder, you will need to become comfortable researching a disease or condition you are not familiar with. There are many resources available to accomplish the needed research. Begin by locating the main term for the disease written in the documentation in the alphabetical index. This is done by finding the condition's bold-faced main term in the index. Once you find the main term, look for the disorder in the indented information below the main term. If the phrase "C condition" is found after the term in the alphabetical index, you should look up the condition by name in the index. When the named condition is not found, return to the alphabetical index and look up the main terms such as disease, derangement, syndrome, or abnormal. Then locate the condition among the indented terms below the main term. Step 2. Turn to the guidelines for the category of code. The category is the 3 digits that begin the code suggested in the alphabetical index. The guidelines will help you prepare to select the appropriate codes in the correct order. Step 3. Look up the suggested code in the tabular list. Begin by locating the 3-digit category first. Again, the category is the first 3 digits of the suggested code. Read any notes under the category code by paying particular attention to mandatory 4th and/or 5th digits that may be required to code correctly. These notes may be printed in a box directly under the category code. Next, locate the suggested code in the tabular list and review the code description to make sure it agrees with the written description. Review any notes regarding excluded conditions to determine whether the condition you are coding is among the excluded items. Assign any required 4th or 5th digits. Check to be sure the code is correct according to the age and sex of the patient. Enter the final code selected, or if the code description in the tabular list does not appear to fit the condition or is excluded, return to the alphabetical index for other possible code selections. Keep in mind that there are times when a provider cannot document an established or confirmed disease, called a definitive diagnosis. While it is appropriate in those situations for a provider to document in the medical record that they are trying to rule out a particular diagnosis, or that a condition is probable, suspect, possible, suspicious of, and/or indicative of a certain diagnosis, it is never appropriate to use this information to select a diagnosis for payment purposes. In these cases, it is necessary to code the signs and/or symptoms of the illness. Signs and symptoms are indications listed in the documentation such as cough, fever, chills, pain, etc. You code the signs and symptoms in the same manner just described. Now let's look up the codes for the following example. Example 1. Choose the correct code or codes in sequence for diabetic retinopathy. If you do not know what the term retinopathy means, begin by looking up the term in your medical dictionary. Then look up retinopathy in the regular alphabetical index of your ICD9 CM book. Look up the indented term diabetic. The code suggested is 250.5. Make a note of this. Turn to the 250 category code guidelines in the front of your book. Here you will find that this category of codes deals with diabetes mellitus. Read the guidelines to make sure you will know how to correctly code for diabetes mellitus. Turn to the 250 category code in your tabular list. Read the notes in the box below the category code. They indicate that a 5th digit is required to code this condition correctly. So the correct code for the diabetes is 250.50. By reading the notes under the 250.5 code suggested in the alphabetical index, you will also find that an additional ICD code is required to code this condition completely. Look up the suggested code range 362.01 to 362.07 in the tabular list to determine the correct second code. The correct codes for diabetic retinopathy in the correct order are 250.50 and 362.01. The ICD9-CM also contains alphanumeric codes, commonly referred to as V codes and E codes. The script for this video also includes examples for V and E coding to help you. Hopefully now you know more about the history of medical coding, how the ICD9-CM codebook is organized, how to set it up for daily use, and the proper way to use the book to code medical diagnoses. Please keep in mind that if you have a textbook that accompanies this class, make sure that you read the material in this book. It will help you understand the diseases and conditions that you will be asked to code. It is also important as you progress in the course to work through as many practice exercises as possible. The more coding you do, the more comfortable you'll become with the process and the tools you have at your disposal. If you missed any of the information in this video, please replay that portion or all of the video again. It is important that you become comfortable with the use of your codebook, as it will become your constant companion as you work through your course and in your future career. If you still have questions, please contact your instructor or learner services advisor for additional assistance.